Hi everyone, welcome back to It's Tuesday lunchtime with Dr. Blum. It's election day. Today is a very important Tuesday actually, and I hope you all went out and voted. I already did my voting this morning. And so I'm good, and I'm on pins and needles waiting to see what's going to happen today. It'll just be good to have this all behind us. So no talking about politics today. But it is on my mind, and I'm assuming it's on everybody's. It's been very stressful, and I actually found myself needing to to manage my own stress. I actually found myself needing to turn off to not watch the news, for a whole bunch of days. And actually, I was at Kripalu last week for 3 days teaching at the Food as Medicine conference, which was awesome. And there's no televisions there, and I got a really great break. So that was great. Anyway, while we're waiting for everyone to join us at the beginning of the hour, as we get started, it always takes a few minutes for everyone to show up. Just a little bit of housekeeping, as my usual format every Tuesday is we start with a discussion about a topic, and today we're going to do arthritis. Oh, sorry, inflammation, but there's arthritis. I have arthritis on the brain because I just finished my arthritis book and I sent it in to my editor yesterday. So yay, but inflammation. We decided, I had this great idea to ask you to vote on what you wanted me to speak on, and I'm so thank you we had so many people send in ideas and they all voted, and really inflammation was the big winner, and so I'm happy I actually have inflammation in my head, all swarming around my head as well, because there's such a big discussion about inflammation in my book, because arthritis is an inflammatory disease. And so, oh, there's my phone, just forgot to turn that off. But anyway, so welcome everybody. As usual, I'm going to do 15 minutes of discussion, and then we will head into sort of answering questions. And so feel free to send in your questions as they come. Now, okay, so good. I usually see questions at the bottom of my screen, which I don't see now, but hopefully I didn't do something to screw that up. And if that doesn't happen, then sorry. I'm actually home today because I finished my book yesterday, and today I have to do, I'm doing a webinar on gut health and stool testing, and I have to do my slides due tomorrow, so I'm home working on slides today. Anyway, so let's get to the discussion on inflammation. And so what's inflammation? Let's just start with the very basics. And I guess I always find when I'm giving talks, people are really confused about this. And I assume you are too, because it was, hands down winner of what you want more information about. And so good. Oh, hi, Barbara. Okay, good. I do see you, and I have comments coming. Okay, I thought I did something wrong, so I see the comments are working good. So thank you on congratulating me for finishing my book. Anyway, it's not out till next fall, and I'm sure I'll have revisions with my publisher, but the manuscript's in, so I'm very happy. Back to inflammation. So the first thing you all have to remember is that inflammation is good. It's been really misaligned in a lot of ways, because we all think of inflammation as bad, but inflammation is actually a natural process that your body goes through, that your body does. Oops, I forgot to press start on my timer. It's a natural process that your body does. And why do we have inflammation? Why did nature build into our body an inflammatory system? And it's mostly because the inflammatory process is how we respond to invaders, to infections, to injury, right? And so if you have a cut on your hand, and you see that what happens when you have a cut, there's the four hallmarks of inflammation: redness, swelling, pain, and heat. And so this area becomes a little bit inflamed. If you injure yourself and your knee blows up, there's redness, swelling, pain, and heat. And what's going on is your immune system is marshaling all of its resources and the whole army and the Navy, you name it, the whole military, the whole immune system is zipping over to that site of wherever that injury or damages in the body, or an infection even, right? So if you have an infected area, you see it's all red and swollen and tender, and that's an inflammatory process. And what happens is all of those, your immune cells that zip over there, they start secreting, which means releasing irritating chemicals to try to kill the thing that came in, like the bad bacteria or the infection, and also to release compounds that bring other cells in. And so they send out sort of flares for help, and they recruit more and more and more immune cells and other cells that will help heal the tissue, which is really good. And so the inflammatory process is meant to be both killing anything that's bad that's there that might have invaded you, and the part of the repair process. Okay, so let's just start with that premise. So inflammation is good, and the inflammatory process results in redness, swelling, pain, and heat. Those are the 4 hallmarks of inflammation. The other additional piece about inflammation and how else you can get it in your body is generally what it is and why it's sort of good, is there's something in the body called oxidative stress, and it's actually the partner to inflammation. Oxidative stress, you've probably heard of antioxidants, and those are all the colorful fruits and vegetables in your food that you're supposed to be eating every day. And I've been talking about diet almost in every talk. I end up talking about food, and today I'm sure we will get to food too. So oxidative stress is, if you think about inside your cells, every cell of your body, you have something called a mitochondria, and the mitochondria is this little furnace, and it makes energy, and it actually keeps the cell alive. That's how your biochemistry works. And think of it like a little combustion engine inside every cell. And if you think about your own car engine, right? Your car has an engine, and we have spark plugs, and you have oil to lubricate your engine, because there are always sparks being made when there's combustion. And it's the same thing inside every cell in your body. There's combustion. You're making this energy. And the process of making energy releases something called free radicals. And free radicals are just an activated, there's different kinds, but think of it like a charged molecule. It's an activated oxygen species, reactive oxygen species, an ROS. But this word free radical is a common one everyone knows. But think of it like there are little embers and sparks being made in your cell every day during the combustion that makes energy for you. And so nature gave you an abundant amount of antioxidants to put out that spark. So there's a normal amount of stress that happens inside your body every day from your oxidation process of making energy in every cell. And so I always like to think of this process, in addition to the inflammatory process that's sort of responding to an injury, as stress and recovery, stress and recovery, stress and recovery. So your body gets stressed, and either it's an outsider stressing you, like a cut in your skin, or an injury, or an outside new thing, or it's your everyday stressor inside the normal process of making energy in your cells. Those are sort of stressors in the body, and then the body always recovers. So it's stress and recovery. And for the free radicals, the recovery part is feeding you enough antioxidants to keep up with that stressor, right? So oxidative stress, antioxidants, oxidative stress, antioxidants. And if you keep up with the amount of oxidative stress in your body, then you will be able to prevent the inflammation from happening, because too much oxidative stress results in inflammation. And that's actually what happens at the joint, inside the joint capsules. It's really fascinating. I've been sort of digging into all the research on this for the past 4 months. One of the drivers for inflammation for arthritis is this thing called oxidative stress. And it's really almost the body's natural process that's gone running amok, right? It runs amok because you can't put the fire out. Because if the embers are brewing and brewing, the little sparks don't get put out, then they've become fires, and the fire is inflammation. And so what exactly then, so this, the inflammation that you feel then is from these irritating compounds that then are recruited and that irritate you from the inside. And so inflammation that's inside your body, and sometimes you have joint pain and you can't even see it, or something, or you have pain or muscle pain and you don't see it on the inside, or there's inflammation that's these same irritating chemicals, we'll call them, are zipping around on the inside, and you might not see them like you have them on in your joints or in the skin, but they're on the inside of your body, and so they can drive a process that can increase you're making plaque in your blood vessels or clots, right? Cardiovascular disease. The inflammation can land in your fat cells, and they can end up creating a disruption in the hormones in your fat cells, which make you sort of over fat, which changes your whole fat metabolism. And so this whole idea of inflammation in the body as an underlying process that's driving a lot of our disease is for this reason. Okay, so I hope I explained that. So I'll give you just a little summary of this part, and then I want to move into the other causes of inflammation, because so there's this balance. So summarizing again, there's this dynamic balance between the normal stressors in your body, oxidative stress, normal inflammation, normal response of your immune system to things, and it gets activated, and then it's supposed to be put out. Stress, activation of inflammation, and then recovery. It goes out, it gets put down, the immune system shuts off, it stops releasing those inflammatory chemicals, and your cells have their sparks put out by antioxidants, and everybody's happy. And so you can see that if you're looking at this as an equation where there's a stressor in the system, or just a normal everyday process that requires antioxidants or requires the immune system to be healthy and in balance, if that gets tipped out of balance, you can end up with runaway inflammation or oxidative stress that doesn't turn off. And then you end up with an underlying inflammatory, the inflammation's winning, right? And the inflammation then is in your body, and it can increase the risk and drives these other processes of developing these diseases and these illnesses that have this imbalance at the root cause. And so if you're thinking about this from a perspective of there's all this oxidative stress and inflammation and immune triggers in your body. So anything that triggers your immune system is going to increase this side of the equation, the part that increases the need, the inflammation, and anything that causes you to not have enough of sort of the antioxidants or the water to put it out, that's going to imbalance the equation. So when the stress side is winning from the repair side, that's when you end up getting sick. So let's talk about how that balance can get put out of balance, and that's where you find the causes of your inflammation. Okay? So what are the main triggers or underlying causes of inflammation? Food, the food you're eating, stress, and your stress system, your adrenals, the stress hormones, and we'll talk about that. And then third is your gut, right? Gut health. And gut not only affects inflammation in multiple different ways, partly because the food and the stress also come in and via your gut to affect inflammation. So and then finally is toxins and infections. So let's quickly go through those. Let's see, where am I? Still 5 more minutes. We're good. So quickly going through them, and then I can answer questions about these in the second half to circle back. But when it comes to food, food has 3 ways that it will sort of imbalance this equation. The first thing is that the food you eat has to provide you with all the antioxidants in order to put out all the little fires all day. And if you're not eating enough of those antioxidants, the stress of that is, you're not going to recover from the stress of that. So you will end up having more oxidative stress and more inflammation in your body. So that's number 1. So it's the foods so we'll do the food you're not eating and the food you need to eat to reduce inflammation. And I see that's a question there. So the foods so you need to eat more antioxidants, right? Because antioxidants will definitely reduce inflammation because it will help put out those free radicals and oxidative stress. And then the other main food group are the fats that you're eating. And fats are probably the number 1 most important driver. Number 1, the kind of fat for driving inflammation in your body. When you think about the inflammatory compounds and chemicals that you have that either irritate you or reverse that, fats can either drive inflammation or put out the fire. So the good fats are things like, that's why fish oil is just thought to be the greatest thing ever, right? Is because fish oil, omega-3s, and a kind of omega-6 called GLA, which is evening primrose or borage oil, and omega-3, which is EPA and DHA, go into what are called the prostaglandin pathways, and they help promote compounds in your body that go around your body and put out all the fires. Really. They feed into all your cells, and they go around. It's like a big water hose for all the little fires in your body. On the other side, if you're only eating processed food, and I can get into the changes and since industrialization and how our fats, what we eat is changed. Our fat supply and the kinds of fat we eat have completely changed. But all the processed oils that we eat, the canola and the corn oils and soy oils, and like all of those oils are all sort of, none of those are those are all weigh your body down with other fats that don't feed into those anti-inflammatory pathways. Those are other omega-6s that aren't really beneficial from an anti-inflammatory perspective. And they fill your body up so that you don't have the fill of the other good fats. And so the kind of fats go straight in, this kind of fat you eat, and then of course there's saturated fats. And there's other saturated fats specifically are inflammatory, very pro-inflammatory, especially the ones that come from animals. It's really the animal fat. So it's animals from cows, animals and fat from dairy. Those very specifically go into the pathways that trigger inflammation in the body. Okay, so circling back with food, so far we've talked about antioxidants, which will put out the free radicals and reduce oxidative stress, and that's part of inflammation, and the kinds of fats you're eating. Okay, so you have to decrease the amount of animal and increase the amount of like fish oil and vegetable fats, and even things like coconut and avocado, which everybody always asks about, do not feed into the pro-inflammatory pathways. Arachidonic acid, which is the one that comes from animal, feeds directly into pro-inflammation pathways. They increase those irritating compounds zipping around your body, irritating you from the inside out. Okay, so that's that. So those are the two food groups so far. And the other way that food increases inflammation or affects inflammation is that if you're eating foods that trigger an immune response, right? So foods that you're sensitive to, foods that you have a food allergy to, it will activate your immune system, and your immune system will release these irritating chemicals called inflammatory molecules, which will make you have some inflammation throughout your body. And sometimes that inflammation that you feel is not in a joint, it's not in one place, sometimes it can be, but that's the kind of inflammation that people sometimes feel that you have brain fog, you just feel sluggish, and that is from a low level of inflammation in your body. And again, inflammation just means your immune system is releasing these irritating compounds called cytokines, leukotrienes. They all have fancy names, but what they do is they zip around your body, they attach themselves to your cells and tissues, and they cause things to not work right. All right, so let that sink in for a second. So inflammatory chemicals zip around your body and affect your cells to not work right. And so that's the three food categories: antioxidants, good fat, and making sure you're not eating foods that you're sensitive to. And how do you know whether you're sensitive to a food? The best way is, we've talked about this for the past few weeks, do an elimination diet, remove a bunch of foods from gluten, dairy, soy, corn, eggs are the top 5, 3 weeks, see how you feel, reintroduce, and see if they trigger any symptoms. Okay, so that's the food part. I want to get to gut, because I think we're at our 15 minutes, but so that's food creating inflammation. Food, and actually there's a fourth way that food affects inflammation. Food is the single most powerful way to influence your gut bacteria. And I want to talk about gut. The gut is actually one of the most important. I actually think the gut is the primary driver for inflammation in your body, because your good gut bacteria modulate and modify and tone and balance your whole immune system. And your immune system is your driver for inflammation in addition to the food that you're eating. And so the gut is central. You must have good gut flora. And dysbiosis, where you have an imbalance in the gut flora, and that imbalance in gut flora increases the permeability of your intestines. And those two things together, called leaky gut and dysbiosis, will increase your inflammation in the body because it just, the contents of your gut goes into your body through the leaky gut, through the leaky intestinal lining, and triggers your immune system and causes food sensitivities and increases inflammation. And again, I'm going to say it again. Inflammation is when your immune cells get triggered by these kinds of activities, like in the gut and dysbiosis and bad bacteria, and they release these compounds that zip around your body, causing redness, swelling, pain, and heat on the inside where you can't see. Those are inflammatory. It's like an inflammatory cascade of events, and those compounds damage you from the inside out. It's like rusting, right? Your blood vessels and everything get damaged from the inside out. You can't see it, but it influences the whole functioning of all those cells. So that's the gut. And then last, and then we'll do questions, are toxins. Toxins, like mercury, for example, come into the cells and increase your oxidative stress. They suck up all your free radicals. They suck up all your antioxidants because you're busy. They deplete your body of antioxidants, which will then increase your oxidative stress. And actually, I just realized one more thing about the gut. When you have terrible dysbiosis or something called SIBO in the gut, you actually have malabsorption of your nutrients. And so all those antioxidants that you're eating so that you're recovering, your stress in your body gets recovered, stress recovery, and you're doing a good job eating everything that's healthy fats, good antioxidants, so that you're always helping your body recover every day from its normal processes that trigger inflammation in a normal everyday process. If your gut is in bad shape, you're not going to absorb all your nutrients. So all those great things you're eating might not be getting in. And so your system's out of balance and you're having increased inflammation and oxidative stress, not because you're not eating those foods, but because the foods aren't coming in to help your body always recover from the constant stressors on its system. So a healthy gut will help you reduce inflammation. It's really the number one way to go. And remember, I believe in that so strongly, and that's one of the reasons I created a whole online gut program at blumhealthmd.com. So I do, and it's there to just help you. You can ask us questions. We're free, online. We have a whole Ask Us Anything where you can submit questions and we answer you. We're just here to support you in the process of healing your gut. But toxins are important, really important too, and I talk more about that in my first book, The Immune System Recovery Plan. Okay, I think the time is, let me see about questions. So is ghee inflammatory? Oh, hi Sapna, that's one of my patients, one of my friends. Is ghee inflammatory since it's animal fat, and how much fish oil should we take? Good question. So ghee is actually filled with butyrate. And so ghee is not inflammatory. And anyone that's from India or practices Ayurveda, we love ghee. It's clarified butter. It is animal. So thank you for asking that question because it helps clarify something people might be confused about. Ghee, while it's from animal, it is actually, the reason why it's anti-inflammatory is because it's filled with butyrate. You know the word butter? Butter gets its name from this compound called butyrate, which is a short-chain fatty acid made in your gut by the good bacteria. And actually, butyrate heals the intestinal lining. It plugs up the tight junctions that that are important for maintaining the barrier of the gut. It's been shown to modify and modulate and support and balance the immune system outside the gut, like in your lymphoid tissue throughout your body. If you eat butyrate or you make short-chain fatty acids, it actually goes and helps support your T regulator cells, which turns off inflammation throughout your body. So we love ghee. In terms of fish oil, for arthritis, I usually tell people to do 3 grams of EPA plus DHA. So for the real most potent anti-inflammatory effects, I go right for the big doses, 3 grams a day of EPA plus DHA, and then 500 milligrams of GLA a day. That's the one from Evening Primrose or Borage Oil. And so I actually use that. Somebody comes in with obvious inflammation in the body where they have pain and swelling in muscles or joints. I always put, that's one of the first supplements that I give. And so the question about would reducing inflammation reduce arthritis? And absolutely. And so actually the treatment for arthritis, so if you have arthritis, the number one most important thing that we're doing to treat your arthritis is finding all the sources of inflammation and removing them and treating them. And so the saying goes that if you're sitting on attack, don't take aspirin to treat that tack. You want to find the tack and remove it, right? That's if you have pain and inflammation because you have a trigger in your system, we want to find that trigger. Most people have multiple tacks, and you actually have to find and remove all of the tacks in order to help treat the arthritis. And so for arthritis, the three main tacks for arthritis is food and the gut. And then stress and trauma are so important because stress, which I didn't really talk about, we'll do that another time. Stress comes into the gut, into the body, via the gut. It completely changes and alters your gut flora. So if we want to repair the gut, which you must do for arthritis because that's the source of your inflammation, you must make sure you not manage the stress piece, and so that it won't keep pushing the gut out of balance. It undermines what you're trying to accomplish. So treating inflammation is the way to treat arthritis. It reduces symptoms and it will reduce your need for medication. And I do that every day, day in, day out. And so we do it with food, we do it with supplements, and there are supplements that are really great for reducing inflammation and that turn off these. So inflammation is, you now know, it's a normal process in the body, but it's running amok. It's like a runaway train. It's supposed to turn off when you don't need it anymore, but it stays on if your body thinks you still need it or if the immune system's not working right. And so sometimes the inflammation that's got started for maybe the right reason needs help shutting off. And that's where the fish oil comes in. And that's where something like curcumin comes in. And that's one of the most amazing anti-inflammatories. Another great herb that comes from India, right? Ghee and curcumin, turmeric. And you can take that as a supplement as well. And for arthritis, you really need at least 500 milligrams twice a day. 500 milligrams a day is minimum of curcumin. I usually use more like 1,000. So a question about SIBO. In terms of treating SIBO, is the autoimmune program diet a good approach to treating it? I think SIBO, the autoimmune diet I'm familiar with that my friend sort of has created, which is fine, is really, 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 really restrictive on all carbohydrates. And so actually, as such, it's a good SIBO diet. So you certainly could do it. The FODMAP diet, which is in a way similar to the autoimmune plan diet. But remember, these diets are only meant to be used, like when you have SIBO, you're only supposed to be on these very restricted diets very temporarily while you're working on healing your gut. You're not supposed to necessarily be on it forever. So there's the jump start, beginning where you clean up your diet, you take away all those fermentable carbohydrates, but then at some point you need to bring them back because for your gut to be healthy and to have less inflammation coming from your gut, you need to make these things called short-chain fatty acids, like butyrate, like we just talked about in the ghee. And so butyrate is going to be created in your gut. You don't have to you're supposed to make your butyrate. You don't just have to eat ghee. And you will make butyrate if you eat some prebiotics and fiber. Now, at first, when you have SIBO, it's hard to tolerate those fibers because you feel a little bloated. And you feel gassy and bloated, and they make some people very symptomatic. And at first, I can see you want to control your symptoms with being restrictive. But eventually, you want to be able to eat those good foods again because ultimately, the healthiest diet for your gut is a good old Mediterranean diet. Limited animal, mostly vegetables, healthy fats, olive oil, legumes, which is not allowed on the autoimmune diet, the autoimmune AIP diet, whatever it's called, and legumes, nuts and seeds, all that healthy fat. And you take away not much processed and not much animal, because the animal is the inflammatory fat. So there's that question. I hope I answered that. The SIBO is, a big issue, and SIBO in my research that I was just doing for my arthritis book, while SIBO is not associated necessarily with arthritis, there's a research emerging that does associate that it does cause a leaky gut, which is associated with arthritis and autoimmunity. So if you have SIBO, when people have SIBO and they're testing in my office, I actually really very aggressively treat it. And because I consider SIBO just another kind of dysbiosis. It's an imbalanced kind of bacteria. It's an overgrowth of a certain version of dysbiosis, and it needs to be treated because you really want to promote really good, healthy gut flora in order to seal the intestinal lining and not have leaky gut, and that will reduce the inflammation that's zipping around the rest of your body that's coming from your gut. Okay, let's see what else. A question about boswellia. Boswellia is an herb that is good for pain. And so for arthritis, absolutely. I actually regularly use herbal supplement like combinations that include boswellia. And so, yeah, so add it to your program. It's definitely reduces pain pathways. It's not really anti-inflammatory. Maybe it has some anti-inflammatory effect, but it's mostly has its effect through the pain pathways. Maybe we've been talking about the foods to avoid to prevent inflammation. And so there's a question about that. Maybe you joined a little late. We talked about that a little bit at the beginning. But just in terms of foods in general then, to prevent inflammation, to avoid and to prevent inflammation, sugar. So sugar, processed food that includes a lot of processed sugar, you need to avoid that, okay? Sugar is actually stimulates your immune system and to respond in an inflammatory way very clearly. We have a lot of research on that. So avoid processed sugar, now I'm not telling you not to eat any animal, but the animal just should be a minority of what you eat. It's really about the ratios of the kind of fat. So you have to minimize the saturated fat from dairy and from beef and animals in that way, the arachidonic acid, and you want to increase the amounts of omega-3s and in your diet. And so eating healthy fats and avoiding or limiting, I don't like the word avoid, let's just do limiting. So limiting processed food with sugar, and white flour products, which act like sugar in the body and is inflammatory, and limiting saturated and unhealthy fats. Which are mostly those. Now, there are some saturated fats that are okay, so we talked about that a little bit. So we're really just talking about dairy and animal food. So that's that. And in terms of trying to think of what else to prevent, I mean, look, when you move off of prevent in terms of food, you move off of a processed food diet, it really does help you reduce inflammation in the body. The other foods you need to avoid to prevent inflammation are food sensitivities. Now, like a food like gluten, for example. I haven't talked about gluten this whole time. I do believe that I put that in the category of food sensitivities. And so the food sensitivities, especially gluten, which is a big one, gluten damages the intestinal lining. It increases intestinal permeability, separate from whether you have celiac disease. And so for me, the people that, for a low inflammation diet, I keep people on a gluten, dairy, and sugar, low preventive diet. So we start out free 100%, and then eventually we get to like a 90-95% rule. So it's like avoiding those foods. I really try to bring the sanity back. Okay, so let's come back to bring the sanity back, finish what you started, and all of that. Because, at the end of the day, for keeping inflammation down, it's like the 80-20 rule. 80% of the food on your plate should be vegetable, alkaline, really low inflammatory food. And 20% of it is going to be some animal food. And maybe you do want to have a little cheese here and there and some dairy, but you're limiting it. And so it's just about balance. It's about keeping things in balance. Okay, so where are we? So I'm at a half an hour. I think I'm actually even longer than that. So yeah, I'm 3 minutes over. All right, everyone. We'll put the posting up again, and you can vote on what you want to talk about next week. If anyone has any more questions, on this topic, it was a little all over the place maybe, but that's because there's just so much to talk about and so much information. So I hope you learned took away what you needed, and I look forward to our talk next week. Have a good day, everyone. Oh, and go vote if you haven't voted. And tomorrow the sun's coming out because this election will be over.